In order to understand why you were prescribed inhaler medications, it is important to understand how the lungs work. When you breathe, air flows in through your mouth, down your throat, and into your lungs. Once in the lungs, air flows through tubes called bronchi. Let's look at another view of the bronchi. You can see that the wall of a normal bronchi is thin, so that there is lots of room for air to flow. Now, when the lungs are irritated, usually by an infection, two things happen to the bronchi. The wall of the bronchi starts to swell and produce mucus. This is called inflammation. The outside muscles around the bronchi squeeze or constrict. This is called bronchospasm. The end result is that there is less space for air to flow, causing you to cough or feel short of breath. Although this process can happen to anybody, people with asthma or those who smoke are more at risk for becoming short of breath. Fortunately, there are medications to help you get better. The most common medications are called inhalers. This is because you breathe in or inhale the medication directly into your lungs. Inhalers come in different shapes and sizes. There are metered dose inhalers, or MDIs, turbuhalers, and the discus. In general, they contain two types of medications. The first type of medication is a bronchodilator, also called reliever, quick reliever, or rescue medication, because it relieves or rescues you from feeling short of breath. It works by opening the bronchi so that there is more space for air to flow. This medication lasts about 4 hours and then wears off. And most importantly, it does not fight the inflammation in the bronchi. So you may feel better for a short while, but your lungs may not be improving. Examples of this type of medication include Ventolin, also known as salbutamol or albuterol, and Bricanyl. The second type of medication fights the inflammation in the bronchi and is called a controller, preventer, or steroid medication. It works by gradually reducing swelling and mucus in the bronchi so that the wall gets thinner, improving airflow. However, this medication works slowly. It may take 1 or 2 weeks or longer to fully work. Examples of this type of medication include Flovent, Pulmicort, Symbicort, Advair, Qvar, and Alvesco. Generally, it is important to use both types of medications, since it is easier to settle the inflammation down when it is at this stage before it gets to this stage. Having said that, some doctors may just prescribe the reliever or rescue medication without the controller medication for someone with very mild symptoms or infrequent symptoms. Now, in order for these medications to work, it is important that you are using them properly. So make sure that you review the How to Use Your Inhaler video. You can always learn something by watching it again.